Hello everyone, I am Dr. Rajeshwari, endocrinologist practicing in Bangalore. As part of the Karnataka Endocrine Society Patient Awareness Program, uh, we have a series creating awareness about various hormonal disorders. In that, I would be speaking about the pituitary gland. What is this pituitary gland? So pituitary gland is a small pea-sized gland. You can see around the base of the brain, just behind the root of the nose. It's a very tiny gland. And if you see, this is an enlarged view. It has two parts. The front part, which is called as the anterior pituitary, and the back part is called as the posterior pituitary. So what does this pituitary gland do? It produces multiple hormones. Basically, it gets input from the other parts of the brain, especially the part called hypothalamus. And also, there are various sensors there to look at the sugars, the water content in the body, salt, and various other neural connections, which gets feedback. And from this, the pituitary gland, through its hormones, controls various parts of the body. For example, it produces what are the hormones it produces? If you see, it will produce this growth hormone, which basically, as the name itself suggests, is very important for the growth of a person, that is achieving the height, especially in children. Okay, and other hormones that it produces are prolactin, which helps in lactation. Then it also produces hormones which makes other hormone glands or the endocrine glands to secrete. So these hormones which are produced from the pituitary, these are called stimulating hormones. For example, the thyroid stimulating hormone, or TSH in short, the ACTH, adrenocorticotrophic hormone, which stimulates the adrenal glands. Then gonadotropins, that is, gonads are the testes in the males and ovaries in the females. So gonadotropins are the pituitary hormones that stimulate the ovary or the testes to produce hormones. The ovaries produce estrogen and progesterone, and in the males, the testis produces testosterone. To make these organs to produce the hormones, pituitary sends the gonadotropins, which are two in number. They are the follicle stimulating hormone and the luteinizing hormone. So these are some of the hormones that are produced by the anterior pituitary gland. Then the back portion of the gland, that is the posterior, it also produces one hormone called antidiuretic hormone, or ADH in short, which helps in maintaining the salt and water balance in the body. So what does what does these hormones do? Basically, growth hormone, as the name itself suggests, it's very important for growth of the child to attain an adult height. So after the age of around 4 years, this hormone is very, very important, and roughly children gain about roughly on the average 5 centimeters per year. If they're not gaining in height, then this hormone may be the deficiency of this hormone may be the cause. In adults, does it mean that this hormone is not there? Of course, in adults also it is there. Only thing is, it doesn't increase the height because the end plates in the bones, they are few, so they cannot grow in height. But it helps in maintaining the body's metabolism, the proportion of the muscle mass, the bone, strengthening. All these it's a continuous process even in adulthood. They are all maintained. Apart from this, lot of metabolic actions like maintaining the sugar levels and such things in the body, through the actions on the liver, on the bone, and etc. So other hormone is, as I said, prolactin hormone. The prolactin, as it says, it helps in lactation. So in a younger age group, children like from adolescent onwards, this hormone is present in females. It mainly helps in improvement of the development of the mammary glands. During pregnancy and after delivery, immediately after delivery, these hormone levels are higher. During pregnancy, it helps in increasing the gland development, and also increasing the breast size. And after delivery, it helps in secretion of this lactation or the milk. So uh, that is the main function. However, if there is any defects in that, there can be failure in lactation, or if there is excess of hormones. See, during pregnancy and during lactation, it should be present in high numbers. However, if the levels are very high, either in males or females, then it can cause problems like fertility issues. In the females, there can be irregular cycles or no cycle at all. Sometimes, even if they are not in the pregnant, they can have some breast secretion of the milk. In males, it can cause infertility, lack of sexual interest. These could be there. Of course, if the hormone is deficient post-natally, the women may not lactate, so they are unable to feed. Then coming to the other hormones, the thyroid stimulating hormone. This hormone, as it says, it stimulates the thyroid gland. So thyroid hormones are T3 and T4. TSH, or the thyroid stimulating hormone, increases it and helps the gland to increase the size or maintain the size. If the thyroid TSH is deficient, in that case, T4 and T3, they are not stimulated, so the gland doesn't produce. So a lot of symptoms called hypothyroidism can develop. In pituitary problems, we call it central hypothyroid, because it is not the thyroid gland that is the problem, it's the pituitary that is called. So they can have symptoms like tiredness, weakness, lethargy, poor appetite, excessive sleeping. They can have problems with bowel movements, the constipation. In females, they can have irregular cycle or prolonged bleeding. Sometimes the in profound cases, the periods can stop temporarily also. Similarly, in the men, sometimes thyroid problems is severe. They can have problems with sexual interest, drive, as well as semen production can be affected. Then the adrenocorticotropic hormone. There are actually two small glands over each of these, capping the two kidneys. This is called adrenal glands. And if there is a reduction in size of the production of the adrenocorticotropin hormone, which is from the pituitary, these adrenal glands, they shrink and they don't produce the hormones. The main hormone it produces the steroid hormone or cortisol. If it is deficient, patients will feel tiredness, weakness, less appetite again, giddiness. Their BP and sugar can reduce or drop also. And the adrenocorticotropin also hormones. Along with that, there is some hormone which helps in the skin maintaining the normal skin pigmentation. So these people can become more paler or lighter in color as well. And whenever we have mild infections, body can cope with it very well. But if they have this deficiency of this adrenocorticotropic hormone or the steroid hormone in the body, they get very easily very sick. Even with mild cold cough, they get giddiness, vomiting, and such things. So they don't take up stress in such situations very well. That is the adrenocortical. Then we have this gonadotropins. As I said, they are very important for maintaining the gonads, that is the testes and ovary. And in the male, the hormone is deficient. The testicular size is very small, can shrink, they can lose all the facial and body hair. What we call as the male pattern of hair is lost. They can have female pattern of fat distribution, lack of sexual drive can be there. Of course, the hormone, the testosterone, which is usually produced by the testes, is reduced. And also there is no semen production or reduced semen production in men, leading into infertility. In women, the gonadotropins are absent, are reduced. Then again, ovaries, they are supposed to release the egg or the ova cyclically. That doesn't happen. Along with that, the female hormones, the estrogen and progesterone, which are produced by the ovaries, they also do not are not producing enough amounts. As a result, the cycles can be very scanty, irregular, and the uterus over long term can start shrinking. The ovaries also does shrink. Ultimately, they can cause also infertility. Of course, these hormones, if they are very less in the childhood itself or very young age itself, around the time of adolescence, if the glands are deficient, these hormone pituitary gonadotropin hormones are deficient, then they don't go through this pubertal changes, whatever the cracking of the voice in boys, facial hair development, you know, all these do not develop. Testicular size enlargement, all these don't happen. Also, they don't develop all these armpit hair. All these. In girls, again, their breast development will not happen if the gonadotropins are absent from a very young age. So they do not start the cycles. In fact, the ovaries and will be small. The uterus will be called as infantile uterus. So they've gone through all the different hormones secreted by the pituitary. So next, what are the diseases if there is any dysfunction? To some extent, I have explained to you what are the deficiencies of these hormones, different hormones can cause. Like the growth hormone, they can be short, all that. However, there can be sometimes when the deficiency happen and the pituitary gland, because it's such a small gland, uh, if any problem happens, multiple hormones can be affected also. So deficiencies may not be of only one hormone. It can be, thyroid, TSH deficient, ACTH also deficient, or ACTH and gonadotropins may be deficient, or all hormones sometimes can be deficient also. Apart from this, sometimes there can be excess hormone production in the by the pituitary gland. For example, a few cells will be producing TSH. Some of them usually secrete the growth hormone. If this group of cells which is producing, for example, growth hormone is producing excess, then they start more of growth hormone. So what happens in children? They start growing very, very tall. Compared to the family, they grow very tall. They have big hands and extremities. The facial jawbones are prominent, and very heavy resonant voice. Um, um, so these things are some of the things in children. In adults, of course, the height doesn't increase, but the hand size, the jaw size, and the forehead, all these can become very, very prominent. They can start having darker skin, especially over the neck, and skin tags can develop. They are prone to develop diabetes, high blood pressure as well. Sometimes the joints are also, they can have joint swellings and pain. So that in children it is called gigantism, and adults it's called acromegaly. So that is excess of growth hormone. If there is, as I said, prolactin, it can cause infertility in both men and women. I explained to you already. And adrenocorticosteroid hormone, ACTH secreting pituitary tumors can be there. They cause more of ACTH. As a result, they start gaining weight, more of steroid in the body. They look very puffy, more of fleshy face, and they can have some more body hair also. They're more prone for the bones and the skin. All these they become weak. As a result, they get very wide stretch marks. Bone weakness can cause sometimes fractures. They feel very weak because muscles are also weak. They have difficulty climbing stairs or walking. They also are prone for again getting diabetes and high blood pressure because of excess of this steroid hormone as a result of stimulation from the pituitary by the ACTH. Of course, in females, there can be regular periods even with excess of this hormone also. And these people tend to become more darker and darker because, as I said, one more hormone is always secreted with ACTH that tends to make the skin dark. Then the TSH, I said, if it is increased, then rare, it is a very not a common condition, but it increases the thyroid hormones, that is T3 and T4 can increase. As a result, they can have weight loss, tiredness, hands and legs are shaky, their gland can get swollen, and they can have frequent bowels, excessive sweating, all these can happen. Then gonadotropins, not so commonly, they are increased in amount. Occasionally they are. Then sometimes the women have more thicker lining of the uterus and heavier bleeding, all that can happen. So what are the diseases that how does all these deficiencies or excesses that can happen? So deficiencies more often it can be by birth, genetics. Sometimes it is multiple hormones can be production can be upset because of a birth defect itself, like a growth hormone along with gonadotropins or etc. Sometimes it can be due to diseases like there can be a infection or inflammation called hypophysitis, or sometimes they have this radiation treatment for some of the cancers or any other brain tumors. In the field, this may also be part of it, so it gets affected. Sometimes post surgery, after surgery of a pituitary tumor itself, then they can be deficient with all the rest of the hormones. So these are sometimes infections like tuberculosis and all can happen. In the past, we used to have a lot of women after delivery, heavy bleeding. They might have a sudden BP drop, and after this, the pituitary gland gets shrunken or gets necrosed. So then ultimately they are left with multiple hormone deficiencies. Of course, hormone excess usually happens because of a tumor producing one particular type of hormone in excess. Sometimes it can produce two hormones, like a growth hormone, prolactin can be both excess in some patients, but usually it's one hormone that is excess. Sometimes when there is excess of one hormone, there can be other, the gland is swollen and it suppresses the other hormones also. So there can be deficiency of some, whereas the excess of other, for example, growth hormone is more, thyroid may be less. That thing also can happen in this thing. Because if I can, you can remember the picture that I showed earlier. For example, it is very close to the nerves that is coming from the eyes. You see the nose is in the middle. On either side, the eyes are there. The nerves from the eyes, both of the side, they meet just above the pituitary gland. Whenever the tumor is very big, is pressing on the nerves from the eyes, it can cause visual defects. Also, this place is very small, close spaced area with a bone down, and if it starts expanding, there is a pressure within the brain, which lead to what we call as severe headache because of the pressure symptoms. So these are some of that is the reason they can have present sometimes with the headache to the neurologist or vision problems to the eye specialist. So how to treat the pituitary problems? So first of all, it should be suspected when they come with particular symptoms. Usually, whichever department they go to, either as a neurologist or eye doctor or a physician, general physician, the suspicion, if it is there, then they can refer to us. We have to, in that case, look at each of the hormones, whether it is deficient or excess. So most of the hormones are higher in our body most in the morning. As the day comes on, it reduces. So based on what we are looking for it, we might have to check the hormone levels, especially in the morning, fasting sample for most of the hormone tests. Sometimes we will check the evening, when it is a steroid hormone, we ask the evening sample as well. Some of the tests, if you're looking for if it is produced in excess or some deficiencies, we might do what we call dynamic test, where we give some tablets or injection before taking the sample, and particular period of the day we'll ask them, and if it is the gonadotropin, we'll ask them to do within a particular times of the menstrual cycle also. After the blood tests are done, sometimes you want to look at the sodium levels. As I told you, the posterior part of the gland produces called ADH, which can cause sometimes when it is the hormone is deficient, it can cause excess of urination, thirst, and dehydration leading to high sodium. And when there is deficiency of other like a corticosteroid hormone, corticotropin hormone, or thyroid, there can be low sodium as well. So these are some accessory tests like sodium levels, the sugar, the blood pressure. These also may be asked. And if there is a suspected tumor and there is headache, vision problems, we will get the eye check, and also we'll get a neurological examination done. Apart from this, then we go ahead with the imaging. Imaging is basically we get usually for the pituitary MRI scan, because the pituitary gland sits in a bony cage almost. So MRI scans are much better than any. It is preferred than the CT scan. Once we confirm that there is no tumor there, if there is only deficiencies of the hormones, there are medications in the form of pills. For some of them it is injections. We give them dose titrate based on the follow-up and the patient's response. Most of these medications would be for lifelong, especially the thyroid and the steroid hormone will be for lifelong. If it is a growth hormone, it's injections. The doctor will monitor the growth, and at the end of the growth period, it will be stopped most of the time for children. And if there is thyroid hormone deficiency, again this will be pills. If there is gonadotropin deficiencies, it may be estrogen tablets or progesterone that are given. In the men, it is testosterone. However, if they wish for fertility, there will be other injections which we again have multi-speciality treatment with endocrinologist and a fertility specialist or a gynecologist, and treat them accordingly by giving gonadotropins from outside. However, if there is something called like a pituitary tumor, then surgery is required. So, for example, unlike other brain tumors, we don't cut open the brain. It can be done through the nose with the help of a ENT surgeon. They may coordinate along the nose. They go, and the approach is try to break this bone small amount, and they approach the pituitary, which is enlarged. They'll do microsurgery and remove it. So they may not have to open the skull from outside. Okay. So can there be any emergencies in the pituitary problems? Yes, sometimes we do have emergencies. As I said, there can be electrolyte imbalance, mainly the sodium. It can be very low with some of the hormone deficiencies, very high as in ADH deficiency when they are dehydrated, if they're not had enough of water. Sometimes there is a pituitary tumor, it was not diagnosed, or if it is smaller one, so it was just left for follow-up or for observation, they may suddenly increase in size, or there can be bleeding, which will cause sudden severe headaches, vision problems, severe vomitings, and low blood pressure. These things can happen. So it can be a very high mortality, and vision sometimes is also can be threatened. So to summarize, pituitary gland, though very tiny gland, it's a very important gland. Not only it helps in maintaining helps in the growth of the body, maintain the metabolism of the body, and all the activities of the whole body directly or through the stimulating hormones. And also it's very important for maintaining the fertility or the reproductive cycle of the body. So that is the reason why pituitary gland is called as the master gland. Thank you.